So the influenza pandemic of 1918 is best understood because of the global interconnections of World War I. It was facilitated by the material connections, the transport of troops, of goods across borders, and a globally interconnected world. So we can watch through U.S. military records as the flu puts people in sick bays, puts people out of their barracks as it moved from March in the first wave of 1918 from Kansas to the eastern seaboard, across the Atlantic, over to the front, the Western Front of the war, affecting the French, affecting the Austro-Hungarians and the Germans, etc. The flu pandemic itself, therefore, is best understood in a World War I context and in terms of the global interconnections that are really the culmination of the Gilded Age and Progressive Era. It's also best understood in those terms as we think about population demographics, modern medicine, and other ways that bureaucracies would deal with this kind of thing. So here's an example, right? The non-pharmaceutical interventions that were the main way of dealing with the flu, that is social distancing, closure policies, hand hygiene, masks, that kind of thing, were pushed forward by modern state bureaucracies, big government, right? We've seen that in the COVID pandemic, and it's just as true then. Those kinds of interventions weren't possible when states were smaller, when they couldn't surveil people, when there weren't as many people in close proximity in big urban areas, and it required modern medical knowledge. Now, they didn't have modern viral knowledge, but they knew a lot about germs. They had a kind of germ theory. They knew that keeping windows open, for instance, doing things outside led to less transmission, and so that helped to inspire those kinds of policies and changes. Another important thing about thinking about World War I is to think about how the World War I overlapped with the 1918 flu pandemic. World War I affected populations around the world, and as peoples and goods circumnavigated the globe, so too did viruses. And so the pandemic itself really is enmeshed in and essential to be understood in the World War I context. And it's also one reason why we have generally not done a great job as historians of explaining what happened with the flu, because World War I overwhelms it in terms of significance. In the US, that's not as much the case, where 675,000 Americans died of the flu, and only something on the order of 125,000 died in the war, and of that number, about half of them died from things like the flu and other illnesses. But in Europe, the casualty rates were much higher for the conflict, as we all know, and therefore the European memory of the flu pandemic is much more modest compared to that of the war experience. And the war experience then also helps us to understand responses to the flu. One of the things that happened in the US and in England was censorship of the press. So people didn't hear about the flu very much because knowing that the flu was knocking out troops and stopping war industry was something that would undermine the war effort. So the press wasn't reporting on that in the first and second waves of the flu pandemic in spring and fall of 1918 in the British and in the US contexts. So too, the war, though, helped facilitate responses. And this is a really important thing to think about. World War I was characterized by new forms of propaganda, new ways of getting that out through all kinds of innovative techniques, including film and radio and all sorts of propaganda posters and rallies and that sort of thing. Propaganda also helped to deal with the flu pandemic. It was a way of generating a kind of patriotism so that people would sacrifice small things in their lives and large things. They'd be willing to not go to school or to work or to wear masks on the basis of thinking that that was in the collective good. I'll give you one example. In the US context, when people defied the draft for the war, they were called draft slackers. By the fall of 1918, if people defied public health orders against, say, getting together or against masking, they were called flu slackers or mask slackers. And there you can see a direct linguistic connection between the war effort and propaganda and patriotism and the flu pandemic effort and propaganda and patriotism. The 1918 pandemic impacted American society in fairly profound ways when you look at it, the historical record, in ways that are often unrecognized. The first thing that historians like to emphasize about the social experience of the influenza pandemic is suffering. And the suffering that was individual, we could see this in the letters that people wrote to each other, their memoirs, their diaries, the accounts of doctors, for instance, who are at a loss on how to treat this. It was the worst flu that they'd ever seen. Some of them thought it might be another kind of disease altogether. It was so bad. People were dropping dead within 24 hours. Hospitals were overwhelmed. In the city of Philadelphia, the clergy-drawn horse carriages that picked up bodies couldn't keep up with the number of bodies in the month of October 1918. And so the social experience was devastating. It was absolutely devastating. And if you think about the long-term effects too, the state of Pennsylvania, for instance, had 45,000 orphans in 1918 alone. The long-term effects were that these were children growing up without parents, that these families and these lives were altered forever. The 1918 flu pandemic also disproportionately affected the young and the healthy. Unlike most flus and many viruses, which affect older people in the population or the youngest people, this hit the people at the prime of their lives, young, healthy people in their late teens all the way up through their 30s. And that's half to as many as 2/3 of all people who died were in that age range. Those are your prime workforce, those are your parents, those are, and so those were in fact the soldiers who were involved in the conflict. They were put out of the war effort, many died. And so it was really devastating. And yet, we have this sense that people forgot about the flu. Well, of course they didn't. In lived family experiences, you find in the historical record lots of accounts of this. You find this in novels, and you find it in art. For example, in novels, you find examples of people walking up the stairs and getting out of breath and remembering the suffering of their lungs from the flu. You find subtle references to people talking about lost loved ones or the lost opportunities of the era because of having to go back to work or having to stop school. And there are many subtle ways in which the flu stuck with people through the 20s into the 30s. And when you think about the end of the progressive era, one of the arguments that many historians make is that the flu and the war kind of curtailed the possibility of major reform. And some of that comes through the lived experience of the flu. Some of that comes through that suffering. People want to return to normalcy, as Harding put it in the 1920 presidential campaign. And for them, normalcy was trying to forget about the flu, trying to live their lives if they were orphans or had lost loved ones as well as they could for as long as they could, having come through so much suffering. So in some ways, that also helps explain why there are no real major monuments to the flu in the US, a kind of hopeful amnesia, but a presence nonetheless.